3,500 years ago, Egyptian physicians wrote a medical textbook that described brain surgery, understood the pulse, and contained treatments that modern medicine has confirmed actually work. The people building the pyramids understood the human body better than Europe would for another 2,000 years. As you consider the sophistication of ancient Egyptian medicine, you might wonder, what sparked this advanced understanding of human anatomy, and can we find evidence of it in their ancient texts, such as the 1550 BC Ebers Papyrus, which contains over 700 magical and medical formulas. In the 17th century BC, Egypt was ruled by the New Kingdom pharaohs, including Ahmose I, who launched successful military campaigns against the Hyksos, and Amenhotep I, who established trade relationships with neighboring countries, leading to an influx of new ideas and technologies. The city of Thebes, with its vast temple complexes, was a hub of learning and intellectual inquiry, where scholars like Imhotep, who lived around 2600 BC, made significant contributions to the fields of medicine, architecture, and engineering. As you delve into this period, you might ask, how did the Egyptians' extensive knowledge of human anatomy, as seen in the detailed drawings of the human body found in the tomb of Rekhmire, circa 1479 BC, influence their medical practices? The Edwin Smith Papyrus, dating back to 1600 BC, is a remarkable medical text that describes 48 surgical cases, including diagnoses, treatments, and prognoses, making it the oldest known clinical document. This papyrus, which is 15 feet long and contains 377 lines of text, demonstrates a deep understanding of brain function, including the concept of cerebrospinal fluid, and describes surgical procedures, such as trephining, which involved removing a portion of the skull to relieve pressure on the brain. Egyptian physicians also understood the importance of the pulse, recognizing that it could indicate the presence of fever or other illnesses, as described in the Ebers Papyrus, which contains a section on the diagnosis and treatment of cardiovascular diseases. As you examine the Smith Papyrus, you might wonder, how did the Egyptians develop such a sophisticated understanding of human physiology, and what role did observation and experimentation play in their medical discoveries? The papyrus also contains the oldest known description of the meninges, the protective membrane surrounding the brain and spinal cord, and describes the use of sutures, lint, and other materials to treat wounds. The Egyptian physicians' understanding of anatomy was so advanced that they were able to perform successful surgeries, including amputations and laparotomies, as described in the medical text of the Smith Papyrus. The Edwin Smith Papyrus had a profound impact on the development of Western medicine, as it was later studied by Greek physicians, such as Galen, who lived in the 2nd century AD and wrote extensively on anatomy and medicine. The Greek physician Hippocrates, who lived around 460 BC, is often credited with laying the foundations of Western medicine, but his work was likely influenced by the advanced medical knowledge of the Egyptians, as evidenced by the similarities between the Hippocratic corpus and the Edwin Smith Papyrus. As you consider the spread of Egyptian medical knowledge to Greece, you might ask, what role did the ancient trade routes and cultural exchange play in the transmission of these ideas? The Greek physician Erasistratus, who lived in the 3rd century BC, is known to have studied the works of the Egyptian physicians and incorporated their knowledge into his own medical theories. The spread of Egyptian medical knowledge to Greece can be seen in the works of the Greek physician Aretias of Cappadocia, who lived in the 2nd century AD and wrote about the treatment of diseases, including epilepsy and diabetes. The legacy of ancient Egyptian medicine can be seen in the fact that some of their treatments are still effective today, such as the use of honey to promote wound healing, which was described in the Ebers Papyrus. The Edwin Smith Papyrus also contains descriptions of surgical instruments, such as forceps and scalpels, which are still used in modified forms in modern medicine. As you reflect on the significance of ancient Egyptian medicine, you might wonder, what other secrets of their medical knowledge remain to be uncovered, and how can we continue to learn from their discoveries? The advanced understanding of human anatomy and physiology demonstrated by the Edwin Smith Papyrus is a testament to the ingenuity and curiosity of the ancient Egyptian physicians, who laid the foundations for the development of Western medicine, and as you consider their achievements, you are left to ponder the significance of their work, and how it continues to influence the practice of medicine today.